I am biological dentist certified with the IBDM, and I am a master with digital smile design. So this is a really cool company that we have been trained with in Spain. And I'm going to go more into all that detail with digital smile design in the presentation. And I've also been an instructor and mentor with the Wellness Dentist Institute since I believe 2018 or so. And we teach a lot of other dentists, a lot of things with wellness dentistry, ozone, smart, and my favorite topic with cosmetic bonding. So back in 2016, I moved to Houston. I started a practice actually in Cyprus, and that was something that was part-timing, and I was actually part-timing with Dr. Katie's office as well while I was building up the practice. And that was back in 2018 to the end of 19 when I was with Dr. Katie's office. So I left and went full-time at my practice so I can start building that up. And we became biological office there as well. And at the end of 2023, decided to sell it so I can, start a family and focus on that. And so I restarted again with Dr. Katie's office in the beginning of 2024. So here we have such an amazing team. Everyone is really high performance here, and really excited to be able to join back with the practice. And obviously, a lot of things have changed back then. And the upcoming years, Dr. Katie really took off with the wellness dentistry. And on the right picture, some of you may recognize Dr. Jones. She gave a webinar last week. And on the right side, that's Dr. Rosalie, which is our biological periodontist. And she is amazing. We love working with her. Okay, so first we're going to talk about how cosmetics is not just for the looks of it. We always want to look at dentistry as a whole body. We're not looking at a single tooth. We're not looking at just the front teeth. How does your bite, how does your smile, your comfort, and confidence all work together? We then treatment plan according to that. We want to look at long-term results and your health and not just the appearance. So always everything we do, health first. When patients come in, we're doing screenings. We're looking at the gums. We're looking at bacteria count and slides of the bacteria in their mouth. We're not just saying, hey, this is how it's going to be when we fix your teeth, but it's going to be like, hey, what is the reason why this is happening? And we look at the root cause of why the bite is broken down, why there's so much bacteria, why people are mouth breathing. And so we look at everything as a whole because your mouth is really the gateway to your whole body. So if you have inflammation in your mouth, there's likely that bacteria has gone into the rest of your body, and we want to take that into account. The things that we do are always going to be minimally invasive, as conservative as we can be, and we preserve as much of your natural tooth structure as possible. And we want anything that we do to last and for you to feel proud of that. And for something that may take some time to get to, we want to take all the right steps because we want to figure out the reason why, screen for that, and then move forward. So something that we do will always be something that we're proud of and will last for you. So the whole body approach, like I kind of mentioned, your body and your smile is connected. And so we always want to choose materials and things that work with your body. Anything that we do is going to be personalized to you. Nobody comes in here with a one size fits all because that's why we do a lot of screening. We use biocompatible materials. So a lot of our new patients, when they come in, they get another appointment and we test the materials to see what works for them because we have lots of different materials. And that's because certain anesthetics may work for most people, but it may not work for you if that's not compatible with you. So we do a lot of testing with the materials. All of the resins that we use are BPA free. We always want to be conservative by design, preserving healthy tooth structure, and knowing that health and beauty go together. We want to look at function, we want to look at comfort and appearance and plan all of that together as one. Okay, so things that we're going to cover today, and that's going to be first digital smile design, which is something that I mentioned earlier, how we went to Spain and we have really great specialists that we work with. Gone are the days where, if you recall, where you take lots of impressions and all the scoopiness. And for some people who have to do like full smile makeovers or full mouth rehabs, even I was guilty of this back then before digital smile design, where we basically take impressions, we send it to the lab. The lab doesn't even have a picture of the patient, and they're waxing it up on the stone model and kind of guessing like, hey, this is how it's going to look at the patient. And then it comes back and, maybe the patient, this is maybe them seeing their smile for the first time when they're actually having that restorations already bonded in their mouth. And so it's a lot of guesswork. And now with digital smile design, we can use records, photos, and videos, and using scans of the patient and being able to design it digitally, which is really awesome. And then after we do a smile design that's fitted for that patient, we go into a smile test drive. And that's where we are able to have the patient come in, preview that actual design on their face before we make any permanent moves. And then again, I'm going to go more into detail with all of these topics. After we figure out the smile test drive and the patients are happy with it, then we're going to move on to which type of material is best for you. Is it cosmetic bonding? Is it porcelain veneers? And then figuring out the next steps. So before we do any type of design, patients typically come in and we always start with a cosmetic consultation. So we're going to meet with you in person. We listen to the concerns. Is it discoloration? Is it chipping? Is it wear? Is there a gap? Is it old materials that are breaking down? And we talk through any inspiration. Some patients come in, they're like, I really want my teeth to look like, this influencer or a celebrity. That's always nice to know because we can plan according to that. And if there's any timelines, is there a wedding coming up? Is there a graduation? So that way we can make sure that we time things accordingly and gather all the materials we need. So we always listen first. We gather records. So on the new cosmetic consultation, the patient, we take lots of photos, we take the scan, we take one radiographic image, and then after that, we screen your smile. So are you a good candidate? Is there a reason why teeth are really breaking down? Is the oral hygiene in good shape? And sometimes teeth that are really worn down is because of an airway issue. So we always screen for that too, because we don't just want to put on a nice smile, not considering all of the things that cause us to begin with, because that's going to affect the lifetime of it, right? So we screen for the smile. We take a look at airway. We take a look at, hey, are the gums healthy? Because I would never do a cosmetic case if the gums are not healthy. We want to make sure that the foundation is strong before we start rebuilding on top. And then after that, we plan with the digital smile design. So going over the digital smile design part, again, using the records, we use the patient's face, the way they talk, the way they smile, and then we account that into our design. Because sometimes even some people who don't smile very big, maybe when they laugh, you see a lot more. And then we take a look at the proportions of their eyes, their smile, digital line. And so this is all going to be guided for your face. So you'll never see two patients leave our practice with the same set of teeth because it's always going to be personalized and unique for that patient using precision and measurements and proportions. So everyone's going to have a different type of smile. And then how this comes together, it's pretty simple, but a lot of work in between, and behind the scenes. So we capture the records, we design it to your face, and then we take that design and we simulate it over the patient's face. And then after that, we work with a lot of the really great design specialists in Spain. And after we get the design, we do a lot of refining, maybe this needs to be a bit longer, portions need to be different. So before we actually bring the patient in to see them. So when we look at the proportions, we look at a lot of things. It's not just one thing. So again, we look at the smile curve, we look at the symmetry, the proportions of the face, and where the lips lie. And even down to the millimeter, this is how precise it has to be. So in this picture you're seeing right here, this is addition and where the gum line is. So where you see those numbers, even down to the microfractions of millimeters, that shows, hey, this is how much we need to do a gum lift by just to create symmetry, balance, create harmony so that the final results look natural and balanced. And we layer that over your scan. So where you see the white underneath the teeth, the transparency, that's where the natural tooth structure lays. And that transparency that you see on top is how much we're adding. So in this case, because we always want to add to teeth and not subtract, thinking in mind, a lot of times patients come in and they want to do a smile makeover just because their teeth are so worn down from grinding or their chips. So our goal is never to remove even more tooth structure. Our goal is to add to it. And so in this case, you can see the transparency on top. That's what we're adding and we're not subtracting anything. So a lot of patients love that because no tooth reduction, which means no numbing, no needles, unless, of course, you're getting something else done, like removing an old filling or getting a gum lift. And when we take into account just the the designing the smile, we always look also at the foundation because we want everything to have symmetry and balance with function. We want to check the pressure points. So where you're seeing there with the different colors is making sure that we're distributing all of the forces evenly, because this is kind of how we're going to analyze so that we can protect your jaw, protect your muscles and teeth for years to come. Checking that we're not hitting on certain teeth too much because that's going to overload that tooth, cause restorations to fail, and a lot of discomfort. So again, everything we do, we want the foundation to be strong so that anything that we place on is going to last, hopefully last longer than you do. And this is where we finish the design, we place it back and simulate it on the patient's face to make sure that it matches with them. Technology is so amazing now. Like I mentioned earlier, we don't have to take that goopy impressions and the patients are gagging on it. We're sending it in through the mail. Maybe it gets lost. The technician pours it up in the stone model and then sometimes it breaks upon coming back. We do 3D oral, intraoral scanners so that we will always have that scan. Let's say something gets, we don't have to worry about it getting lost. Years later, if the patient comes back and they're like, hey, you know what, something is off or I need to do something, then we'll have that scan from previously and we can always reprint that, refer back to that, and always have that. So it's not something that we're going to lose. We also have an in-house 3D printer, which is really cool too. So we don't have to rely on the lab to print it out. We have that scan, we can print it out, we can print out the designs and have things done much more accurately and more precise. Okay, so the really fun part now, the smile test drive. This is a really fun appointment. So after the consultation and we do the design on our end, the patient comes back after maybe 2 to 3 weeks or so when the design is done. And now we can actually bring it to life on the patient. So the patient comes in and this is how this works. Now, after we print it out with a 3D printer, we have the design on that model. And then we make a matrix that's fitting on with that design. And then no drilling, basically a patient comes in, we get to try that design on the patient so that there's no commitment. We want to see if what we design digitally will actually match with the patient. And so the patient comes in and we'll overlay it, we try it on, and then the patient will be able to see, hey, do I like the smile? Do I want, these teeth to be longer, shorter? So we love these appointments because the patient can actually communicate with us, if they like the color or if they want something a little bit differently. And then it's very easy to go back, tweak it digitally, and then whether we want to do another test drive, that's up to the patient. And so we don't do anything until we know for sure that the patient is really happy with it. So I want to show you a case. So this is our hygienist, Laura. And she has shared with us that she was not happy with her smile. You can see on her picture there that she has some old fillings that she's not happy with. She has some wear on the lower front teeth. And then when she smiles big, she can see a lot of gum tissue. So we actually did a smile design for her. And then we did the test drive on her. So I made a little short video so you can see that. So really the whole appointment, we give it about an hour so that we can show the teeth and talk, but really when we place the design on and then remove it, it really just is a 10-minute process. And so it's very subtle, but you can see a huge difference. I recently discovered when I'm doing video editing that there's so many different functions that you can do to add theatrics to it. So I went a little excited with that, so excuse all the theatrics. Okay, so this is kind of like what we're looking at. So her before photo, what she was not happy with or things that she wanted to change. So after the design, we were able to test it on her and see how much we're adding. And she was able to really love what we designed for her. And so she's waiting to get some bonding done. And she's been asking, when are we going to get this done? So we will get there, Laura. So why patients love the test drive? It removes the fear of the unknown. You get to see that new smile on your face and decide if you're confident with this. And plenty of times I've had patients, most of the patients actually really love it, but there are times where patients have said, you know what, I actually want the two front teeth to be shorter, to be kind of more even with everything else. And that's totally cool. And I'm really happy to hear things like that because now I can fix the design and not have guesswork. So now we're not surprised and there's peace of mind for the patient because it's going to be designed around what they want. It's kind of crazy to think about back in the day when we used to do smile makeovers and cutting tooth structure. And now even the doctor doesn't even know what it's going to look like until the final product is in. And now it's going to be much harder to go back and fix it instead of having it planned in the first place. So we always start with the end in mind, and then how do we get there? We kind of work backwards on whether we're doing restorations, whether we need to do orthodontics. So after the test drive, the patient gets to see what the plan is. We kind of plan, hey, does the patient want whitening, whether we have to send them to orthodontics. So we always want to plan with longevity. So there are patients where if their teeth are really misaligned, I would hate to have to cut tooth structure to get a nice even smile or to do any type of restorations with them hitting on certain areas too much. So a lot of times I either give them the option of doing orthodontics to straighten it out and align it so that we can have the right position and do less restorations. So patients say, I really don't want to do orthodontics again. Maybe I've gone through 2 or 3 times of it and I just would prefer doing something cosmetic. And that's totally workable. Anything can always be done as long as we plan ahead. So now after patient is happy with their design, now there's two main types of restorations that patients have the option of, and that's going to be cosmetic bonding or porcelain veneers. So after we test drive based on the patient, whether their budget or whether they have certain goals, like if they don't want orthodontics or they do, whether they want to be more conservative, then we kind of plan out which option they want to go with. So porcelain veneers. Now, porcelain veneers is a really gorgeous type of restoration. They last pretty long. They're very natural and aesthetic looking. They're very strong, stain resistant, and it's built to last for a decade or more, considering that the patient actually has good oral hygiene habits and biting forces and things like that. It's really good for patients who also don't want to go through orthodontics and maybe they're okay with tooth structure removal. However, a lot of patients are not thrilled with the idea that there has to be some tooth structure removal. There are porcelain veneers out there where it's no prep, but the patient actually has to have really ideal conditions for that. Their teeth really adding on, not having it look bulky or it's in the right position. Otherwise, the majority of types of porcelain veneers do require some type of tooth structure removal. And to be honest, ever since I've started doing cosmetic bonding, I haven't done a whole lot of porcelain just because patients choose the option of saving teeth. And the fact that we're wellness focused dentists, I prefer also not having to remove a whole lot of tooth structure. So now we're going to go into my favorite procedure of all time. That's cosmetic bonding. And this is where it's going to be planned. So where we did the smile design and the test drive, and now we're not going to be doing freehanded. Like, a lot of times in the past, cosmetic bonding had to do with freehanding it each tooth, and you're kind of like guessworking or you're in the chair for a really long time. Now we actually have the design. We can make a mold of that and actually place it on with precision. So any two dentists with that same design is going to be able to come up with the same results. And so this is going to be really gentle because as long as the teeth are in the right positions, we're going to be adding to the teeth. A lot of times patients don't even have to be numb and it's easily adjusted and repaired. So let's say we did cosmetic bonding, patient is walking their dog or something, and they accidentally fall and they hit their tooth, some of their teeth or bonding chips off, then the patient can actually come in and we can repair it the same day, which is really cool because let's say if it was porcelain or something that was lab fabricated, now we have to cut it off, put a temporary, send it to the lab and wait for the lab to come back a couple weeks later. This is something that we already have the mold for. We can repair it and make it look exactly the same as when they did it the first day. Okay, so these two cases, they have a little bit of chipping and wear. So even though it's more subtle, it makes a huge difference with the symmetry and the balance. Because if you take a look at this, you see on the left side, the patient wasn't happy with some of that wear and the chipping on that front area. And then that darker area is an old filling that he had. And so he wanted to make sure that he wanted a more even, natural look. And so we did that. We did the design, we did the bonding. And in this case, he didn't have to do very many teeth. And you can see it blends in. It looks really natural, has that shine and luster like porcelain would have. And then the picture on the right side. Now, I know also a lot of patients even like the look of that, and that's okay. This patient in particular noticed that his two front teeth used to be longer, and then they were starting to wear down. He noticed every year they were getting shorter and shorter. And so he came to us to make sure that he can rebuild back what he lost and then protect it from getting worse. So that's really key with early prevention because when we do the screening, we're seeing, hey, the teeth are wearing down. And really, when teeth are wearing down just from normal eating and chewing, it should be maybe a millimeter for every 100 years. And so some people come to us and they're like 100 years, 200 years worn down, and they're definitely not that old. So we want to make sure that we stop it in this track. So in this case, we rebuild back what he lost. And again, you can see not that many teeth involved, but he was really happy with rebuilding back what his natural teeth look like and then preventing it from getting worse. So we're able to restore it and then put some guards on him so that way he doesn't keep wearing teeth down. Okay. And so this case, she actually came in because her teeth were really misaligned and she was really wearing down those two front areas because of the misalignment. So we went through Invisalign and then afterwards, even though her teeth were all in the right position, the symmetry was there, but she still wasn't happy with her smile just because she had that wear in the front. And instead of filing it down and making the teeth shorter so that it's straight, we did bonding just those two front teeth. And after that, she was super happy with it. And you can see the restoration of that, the symmetry, the balance, and the harmony. So she was happy with the smile after that. Okay. And this is a case that's actually pretty dear to me. She's this amazing patient. She actually came about a year and a half ago. And you can see her gums were really red. She has an autoimmune disorder. She had failing metal and mercury restorations in the back. Teeth were kind of falling apart. And then she said that her front teeth, she feels that they're really crumbling. Her bite was off. And so she was afraid to actually chew and eat things. So she was sharing this with me recently. So the fact that when her teeth were really breaking down, all she was eating was soups at home. And her husband, unfortunately, had to follow that same diet that she was cooking. So for a long time, he was just eating soups and really soft diet with her. Starting with her, her goal was to fill back in cosmetically as well. That was the second concern of hers. But again, didn't want to do anything until her health was in good condition. So we took care of the teeth that were breaking down, infections, the bacteria that was really persistent in her gums, taking out that mercury, the metals that were leaking and causing a lot of health issues. In her case, you can see that her body was not reacting well to that metal. So it just wasn't compatible with her. And so after we did all the restorations and getting back her health, and you can see in that bottom picture, her gums look way healthier. So this is actually just done 2 months ago. So she finally was ready. And then she's like, I actually feel better. My health feels better. Let's get to the next part of rebuilding. So we did the design, we did the test drive. She was so ecstatic even at the test drive. So finally, we did bonding all the uppers, all the lowers, minus the very back teeth because she actually has some porcelain crown. So there's that one that's a little bit more darker. And that's because she had an existing porcelain crown that decided to leave it alone. So we left that. And then we did all cosmetic bonding for her. And she was so happy to be able to have that smile. And she couldn't stop smiling. And even her husband was super excited. And she shared with me when she came back for the 1 month post op that now she's starting to feel more confident with eating more solid foods. And she's like, I'm finally able to eat steaks again and not worry that my teeth are going to crumble and fall apart. And so that means her husband is happy because now he gets to eat steaks and other things too, not just soups. So this was a really cool case. And she did a really awesome testimony that, she shared. And so I have it on Instagram if you want to see that. Okay, so other really awesome things that bonding can do is this patient, she's 14 years old, and we literally just did this case 2 weeks ago. She finished orthodontics, but she was actually always congenitally missing that tooth. But in this case, she was missing that tooth, never had that grow in. So she finished her orthodontics and then came to us for the design. And so in this case, we designed the smile for her and we only did the front teeth area. So we can actually accomplish putting a tooth back in there with cosmetic bonding. And that's really awesome because it means that she doesn't have to take anything in and out. We don't have to cut down the two teeth structures just to place a bridge in. And this is, again, reversible because it's cosmetic bonding. Adding to tooth, we're not taking any natural tooth structure away. So she's going to have all her natural teeth underneath there. And when she gets older, when she's ready to either do an implant, who knows, by then maybe teeth can be regrown back because they're in the trials for that right now. And so this is something that will give her that confidence, let her go through school with that confident smile and not have to worry about something that can fall off or break or cutting natural tooth structure. And this is going to last for years to come. Now, typically, whenever we have a bridge, always making sure that they can clean underneath it well with either a threader or using a water pick. That's going to prolong the life of it. And then this is a case where they're peg laterals. And what that means is the two teeth next to the two middle teeth are naturally smaller as well. So both of these are actually siblings. Sometimes we see it genetically. Brother and sister, both really young, still in school, high school, and they really wanted their front teeth filled in before they went back to school. So I think this was during winter break. And so both of them had finished orthodontics. So the good thing is we love to communicate with orthodontists because sometimes orthodontists will actually send us cases from outside too. And they'll know that maybe we can fill in those lateral teeth so that it looks more symmetrical. So the orthodontist talks with us first, we communicate, and then they know where to put the teeth at so that we can space it out correctly. And in these cases, you can see only the front teeth were done. And then we filled in those peg laterals and we made it natural looking teeth. So that way, again, restoring their balance, function, harmony, and patients were really happy and really conservative, don't have to cut down tooth structure. So we literally just added to this and patients didn't have to know. Okay, so now we're going to kind of go over the comparisons just to recap it. Again, there's no single best, it's just what's best for you. And so some people, again, if they decide to do cosmetic bonding, we use tooth-colored BPA-free resins, often a single visit, as long as we do all of the pre-planning ahead of time and the patient does a test drive, they're happy, so they come in and we do the bonding all in one day. And then the tooth preparation, minimal to none. Sometimes if there's like a rotated tooth and patient doesn't want to go through orthodontics, we may do a very minimal reduction. Otherwise, if the teeth are in good position, you don't have to prepare the tooth at all. And stain resistance on that is good. However, it does stain according to how your teeth stain. So some patients, if they drink a lot of coffee or they do a lot of things that stain their teeth, just like natural teeth would stain, then whenever they come in, we can always polish it and it really comes off pretty easily. And that's really with good maintenance. Investment wise, it's more affordable than porcelain veneers just because we're cutting out the lab. The lab doesn't have to be involved. We don't have to pay a middleman. And so the investment is typically half the cost of porcelain veneers. So porcelain veneers, that material is different types of porcelain materials. So that's going to be custom for that case. Visits usually at least 2 visits because the first one is preparing the tooth, filing it down, sending in impressions or the scan, and then the lab sends back the case and they come in and cement that on. Very dependent on tooth preparation as well. So typically there's a thin layer that's reshaped. Stain resistant is really excellent for that because of the porcelain material. The investment is going to be a little bit higher, obviously, because now we have to include a lab that has to spend a lot of time and cost with their materials on making the porcelain veneers. So after doing cosmetic treatment, always wanting to invest in that treatment. So we take a look at, again, what was the cause of having the teeth redone in the first place? Is it from sleep apnea? Is it because the teeth are so worn down from sleep apnea? So basically, when we screen for airway, if patients do sleep tests, if they're grinding because their teeth are, or they're not breathing well, and so their jaw kind of tries to move and the teeth are just really stuck together because the muscles are tight from that, then that can cause teeth to wear down. So we want to look at doing a sleep test and seeing, hey, are we going to put you in a sleep appliance to help protect your teeth and also to help you with breathing? Or if they don't have it, then we want to put them in a night guard if their primary cause is stress or things that just causing a habit of grinding. Or let's say if they just had orthodontics done, then we want to put them back in retainers after that with a new scan so that their teeth don't move. And we always want to tell the patient to protect their teeth from excessive force. And that's even with natural teeth, like teeth are thinning or wearing down. You don't want to bite into things. And so after all the investments, you want to make sure that not biting into things, cutting it up, eating with the back teeth, and it's really going to make the teeth last much longer. So not biting into hard foods. Okay, so now some pretty common questions I get, and we're going to answer some of them now. So first, does it hurt? And the answer is no. Because again, we're adding to tooth structure, and this is all specifically for cosmetic bonding. So typically it doesn't hurt. Let's say in case we do have to do some gum lifting or there's an old filling or an old crown that has to be removed, then yes, we'll numb you up for it. But typically from the test drive down to the actual bonding, very comfortable. Patients have been turning on the show and they're just watching TV. So very little discomfort. And then we kind of went over a little bit about how to choose bonding or veneers. And again, that depends on whether you want things that last long and you don't mind tooth structure removal, or if you want to be more conservative. and that's going to be able to determine what you're looking for. And will bonding stain? Yes, it can stain just because any natural tooth structure can stain. And the great thing is when we have bonding, our hygienists are actually trained to be able to polish and remove any staining. So whenever patients come in for maintenance, whether it be 6 months or 1 year where they just need some maintenance on the bonding, but we always want to tell patients too, after bonding is done, and if they decide to go back to their dentist somewhere else, always come with the fact that the bonding cannot be polished with that paste. Sometimes some places have prophy paste that can polish, but that tends to create little scratches in the bonding. So always making sure that the patient is aware of that and using the right tools to make sure that they can clean around that. And no, it's not just cosmetic because we always look at the foundations. No, some patients do a lot more bonding on upper and lower just because of their bite. And for certain patients, it's not even about cosmetics. They don't even care about the way their teeth look, but they want to make sure that their bite is even because it's not even and they don't want to go with the orthodontics. Then we'll plan it and then we make the function so that everything is biting evenly, more balanced, so that there's longevity. And then the cosmetics obviously come secondary, but it's like a nice side effect to have a nice smile as well. And the number one question I get is how long does bonding last? I actually had a test drive today, and that was one of their first questions. This really depends on the patient. So many factors. Is your oral hygiene good? If there's a lot of plaque buildup, then plaque is going to be more acidic, and that's going to cause the bonding to break down. Even with natural tooth structure, it's going to cause cavities and cause gum disease. So oral hygiene habits, regular maintenance is a patient coming in every whatever amount of time they need to come in to get maintenance. You don't want to disappear for a couple of years, come back and things are breaking down. So regular maintenance, nighttime appliances, we kind of talked a little bit about that. Patient habits, are they using their teeth as tools? Are they chewing on ice? Because all of these things are going to break down the lifetime of the bonding. The acidity levels, certain patients that mouth breathe or they have GERD or they just chew on limes, or things that have a lot of acidity. Bonding, just like enamel, enamel is the strongest thing in your body, but if they're being exposed to a lot of acid, then that's going to break down because enamel also really doesn't like acid. And then the good thing about the bonding that we do here is that we do back it up with a 6-year warranty. So let's say, teeth chip, then we'll back it up and be able to fix that chip same day with that 6-year warranty. And then other question, what if I change my mind? And that's exactly why we do the test drive first. So that way, they're a little bit more clear with that. And remember, with cosmetic bonding, all of the natural tooth structure is still underneath there. So let's say, sometime down the line, if the patient decides, you know what, I just don't like it anymore, I want to take it all off, then it can be removed, safely. And natural tooth structure is still underneath there. So there's no harm in it really. And so that's why a lot of our patients end up choosing the option of having cosmetic bonding. And that's something that I would probably choose for myself or, if a family member, because I know that's the wellness focused solution. Okay, so just to kind of recap everything again, from everything we talked about today, from the beginning to the end. So the first step, consultation, patients will come in, we'll meet them in person, talk about their concerns, their goals, and then we'll take the records. And then on their back end, we're going to do the digital smile design. That's done for specifically for that patient. The patient will then come back. We're going to do the test drive, preview, approve it. Patients let us know if they love it or if they want to fix anything. And then after that, we plan it according to which restoration they choose, whether it be porcelain veneers or cosmetic bonding. And then now they come in and now we create that. We bring it to life on that patient. And then after that, we go over all the steps to make sure that we maintain it, keep it from breaking down, and then the patient will be able to have a healthy, confident smile that is designed for you. Okay, so the next steps. Now, a lot of times we do have dentists that refer patients to us for cosmetics or patients that seek us out. They either see Instagram or they see social media, or maybe their friends had bonding done and they're happy with their dentist, and that's totally great with us. Some patients are existing patients or new patients, but if the patient has a dentist and let's say they really don't want to do cosmetics and they send the patients to us, then we can do that screening and then we can do the bonding and then they go back to their dentist. Designing your smile. So we always start with that conversation, talking to the patient. booking the smile design and the test drive. And then a lot of times we even have patients that come out of town to see us. And again, we have a lot of dentists that we network with, and they know that we really specialize in cosmetic bonding. So they'll send the patients to us, where again, the patient finds us, and then they go back to their current dentist for the rest of the recare. And this is actually a picture of my assistant that I used to work with at my previous practice. Her name is Lexi, and she was watching me do a lot of cosmetic bonding. So she was like, I really want to get mine done. She had the same thing, breaking down teeth. And so we did bonding on her. We did some gum lifts, and this is her post bonding. It's actually been, I think, like maybe 6 years, but about 6 years, and they're still going strong. So we know that the bonding will last. And she said she started really taking care of her teeth after she got the bonding done. So she's very diligent about flossing and brushing and getting her maintenance. Okay, where you go does matter. So make sure that you do your research, because there's a lot of places. This is just a case I took off the internet, that this patient unfortunately went overseas to a place that did aggressive reduction of her tooth. And remember, when you cut tooth, it's permanent. And in this case, a lot of patients go out overseas because they want to save money. There's a lot of really great clinics out in different countries, but make sure you do your research, because in this case, she had so much tooth structure taken down, and she was having a lot of pain, infections. And we hear that pretty often, where they come back and now they have restorations, but they're in so much pain, and now their nerve is affected and they're getting infections. And now it's going to cost a lot more to fix it, remove from pain, and go backwards, right? And so we want to plan for the long term. So that lower right picture right there, some patients really like that really white Hollywood type of look, and that's okay. If that's something that you like, then always communicate with your dentist that. In our practice, we like to have things that look a lot more natural. And so using that smile design of the test drive and the materials we use, we like to have a more natural appearance. I even had a case where we did full upper, full lower, but then when they came back to me for the 1 month post-op, I was like, oh, so how did it go? How did your family react to it? How did your friends react? And then she just said, no one even noticed. They just said, did you get whitening done? And that was it. Nobody even noticed that her teeth look different, because that's how natural it looks. So that's our goal, is always to have natural look. But if there's something different you want, always communicate with us. Okay. So follow me on Instagram. Honestly, I have not always been great with social media, but this year I made it a goal so that I could start posting a lot of my cases and more informative type of videos out there. So I've been trying to be really good about it this year. So please follow me on Instagram. If you have any questions, or if you want to direct message me, that's a great place to reach me. Okay. So thank you for tuning in. Next week, we have our really awesome biological periodontist. Her name is Dr. Rosalie. She started working with us this year. And honestly, it's very hard to find a good specialist that's also wellness and biological. So we came upon this unicorn here. She's brilliant. She is really skilled, and we love working with her. Next week, she's going to be talking about the difference with ceramic versus titanium dental implants, which is right for you. A lot of times, most mainstream and a lot of specialists and a lot of dentists were used to doing titanium implants. So a lot of our patients actually have titanium implants already. And what we found is some patients just are not compatible with titanium, or it just doesn't work well for their body. And now ceramic is actually becoming a lot more popular with the biological world, because it's more compatible. But she's going to go a lot of detail of that for you next week. So make sure you attend that, because it's going to be a really good lecture. Okay, thank you so much for spending your time with me. I'm going to see if I can answer some questions. Okay. So is cosmetic bonding like a denture, or are they placed on like individual teeth? So I know what we saw earlier with the test drive, everything was put on as one unit, and that's not how cosmetic bonding is going to be. It's going to be individual teeth, because we want the patient to be able to floss, to be able to clean between, and that's going to prolong the lifetime of it. So yes, they're always going to be separate teeth. Unless, of course, it's like the bridge that we did earlier, where everything was 3 teeth together. That's going to be together, but everything else is going to be separate, even if it was porcelain veneers, for the most part. Yes. Okay. How much is cosmetic bonding per tooth? Great question. So the cosmetic bonding that we charge for our practice is $1,500 a tooth. And our goal, again, is always to do as little dentistry as possible. So as long as we can get the teeth in the right position, We always want to do less is more. Some patients, they want to do the full, but we always want to do little. And the great thing about the test drive too, one thing I want to note is that we typically design it so it's ideal. So they'll be able to see a full smile. And then we can actually remove some of the back ones, remove here until the patient, sees, hey, this is what 4 teeth look like. This is what 6 teeth look like. And so that's typically the charge. But yeah, everyone's going to be different in how many teeth are involved. After cosmetic bonding is finalized and delivered, and I change my mind on how a certain tooth looks, would I be able to still make those changes? Yes, absolutely. Because we love cosmetic bonding because it's done chairside with composite material. So anything can always be adjusted, even after we do the bonding. Let's say the patient comes back a month later and they're like, you know what, I actually want these teeth a little bit shorter. Yes, we can just polish it off, make it shorter, or we can even add. So yes, things can still change afterwards very easily. We don't have to worry about now we have to involve the lab and make a new porcelain veneer. So yes, 7-year-old missing primary tooth age, 10 not developing, what age to consider bonding. So we actually have kids that come in too for bonding. I know that there was a couple of patients that came in and they just had really decayed teeth or teeth that were actually arrested, but now they're really worn down and the teeth are darker just because if they use like silver nitrate or something that arrests the lesions and it turns dark. And now we have to wait for the teeth to grow in or for those to come out. And the kids are just very self-conscious about that. And kids are kind of mean sometimes if they go to school and they get bullied or things like that. So actually, we could do bonding at any age just because of the fact that it's conservative. We're not cutting tooth structure and we're either waiting for teeth to develop or to come in. So really, any age can be bonding is good for. What happens after 6 years? Another good question. We don't have to redo after 6 years. Really, what happens is when the 6-year mark comes up, then that's where our warranty ends. But it doesn't mean that the bonding ends there. So if there's certain areas that just need some minor adjustments, we can always repair it with the template or if you want a new design, whatever the case is. But no, we don't have to redo everything. It's really depending on if we need to repair certain things or not. And so, yeah, it's not everything that has to be done after the 6 years because we've seen that last way longer than that. I hope that answered that. Okay. Sorry, another question. Would be able to do cosmetic work if my teeth are not perfectly straight? My teeth are slightly turned and gapped. Yes, and this really depends too on the design. So that's why we always want to do the design so that when you come back, we'll see what the design looks like. And typically, when I do the design, I actually consider two different scenarios for a lot of cases. I either come up with a scenario where we do orthodontics or we don't do because we always want to be prepared for whatever the patient wants. So if the teeth are not perfectly straight, so let's say if they're really turned a lot and it would require tooth reduction, then it might have to be, porcelain or something else. But if the patient decides to go with the orthodontic route, then that'll kind of straighten the teeth and we can do cosmetic bonding or things that don't require a whole lot of tooth structure removal. But yes, cosmetic work can really be done for anybody, depending on which goal you're trying to do. What product to use for polishing on both teeth? So we actually, the hygienists here, they have the airflow. So they use that and they're not using the polishing paste directly on there. And we actually use the polishing wheel. So there's two things that we use when we do the actual bonding that helps to make it smooth, make it clean, and remove the staining. So the hygienists are trained to use that because it's also very conservative. It doesn't remove that bonding. So they use that to polish it off and then it kind of re-shines it, gives it that luster again and removes some of that staining. Okay, so seems like making sure nobody else has any questions. Thank you so much all for joining me tonight. Feel free to call, send messages, or send me a direct message on Instagram. I'll be happy to answer any other questions you have, or if you need to talk about something, I'm there for you. Thank you again. Hope you all have a great evening, and we'll hopefully see you next week for Dr. Rosalie's presentation. You don't want to miss that. All right. Thank you guys. Have a great night.